It has been 15 years of growth, 15 years of partnership, 15 years of teamwork side by side, driven by a shared vision and mission to realize better health for people across our region and beyond. 15 years may sound like a long time, but for us it was an opportunity to create a real impact, to listen to the needs of our region, country by country, community by community, in one of the world's most complex and dynamic contexts. And we worked. We invested in people, in health workers, communities, and young people. We invested in research to better understand our realities, and we built bridge through communication, collaboration, and networking. All of this has been directed towards strengthening public health system with a focus on long-term solution, tackling challenges in routine immunization, infectious disease, emerging threats, non-communicable diseases, mental health, maternal and child health, antimicrobial resistance, climate change, and zoonotic threats. Today, we gather not only to mark these 15 years, but also to launch a landmark publication, the EMPHNET 15 Years Report. This report presents the numbers and achievements within the context of initiative carefully designed to address diverse health challenges of our region and the pressing needs that shape our priorities. It offers a unique resource for public health practitioners and decision makers seeking sparking ideas for what works best in a constantly evolving health landscape.
I still remember it clearly. Back in 2009, my colleagues from across the region and I began conversation about the pressing need, the need for a network that could connect us, build capacities, and strengthen public health systems across the region and beyond. We spoke about field epidemiology, about research, surveillance, and programmatic approaches that could reinforce every component of our health systems. We knew that epidemiological and capacity was essential. Yet, in many of our countries, it needed to grow. Out of that shared need, Eastern Mediterranean Public Health Network, EMPHNET, was born. Not as an important idea, but as a network created by the region, for the region, designed to serve its own priorities and its own people. From the beginning, our mission was clear: to be present where it matters most, in the field, in underserved areas, responding to real public health challenges with local solutions. And now, 15 years later, the report we launched today documents the journey. It's a record of what we achieved together and a guide for what must be done next. This 15-year report captured the heart of our work, the investments we made in people. And really, at the heart of everything we did was the human element. For no health system can stand without a capable, empowered workforce. Through training, regional exchange, online learning, and practice-based programs, we reach those working at all levels, especially in the peripheries where it matters most. Through our field epidemiology training programs, we establish structured applied epidemiology models tailored for our context. When threats emerged, these were the professionals who investigated, analyzed, and delivered evidence-based recommendations. And we went further, remaining focused on sustainability. We supported rapid response teams, prioritizing institutionalization and lasting impact. We built capabilities in biorisk management, partnering with experts, governments, and One Health stakeholders to develop practical national tools that will continue to guide daily operations today. We empowered researchers to generate evidence from within the region and created spaces for them to share it. We supported young learners, students, and early career professionals, believing in their role as the next generation of public health in this region. Today's report captures these stories. It highlights the real-world impact of investing in human capacity, offers country experiences that others in the region can build upon. A 15-year report also documents how regional priorities were translated into programmatic support, recognizing that meaningful public health change requires programs that are both structured and sustained. That's why we partnered with ministries, local institutions, and the international community to strengthen disease control programs. We did not just offer technical expertise, but work side by side to support surveillance systems, improve logistics, plan responses, and advocate for change. Our focus on routine immunization, for example, saw us supporting countries in achieving coverage goals and responding to vaccine-preventable outbreaks in conflict-affected and refugee-hosting settings. We applied the same programmatic discipline to non-communicable diseases, mental health, and health security, ensuring gains in one area would not come at the expense of another. In the face of climate change and emerging zoonotic threats, we fostered cross-sector collaboration through our One Health work, developing frameworks, guidelines, and tested coordination mechanisms. The 15-year report documents these experiences, touching on strategies, models, and lessons learned that can guide countries, partners, and public health professionals as they face today's challenges and those yet to come. Perhaps most importantly, this 15-year report tells the story of the partnerships and collective efforts that made it all possible. None of this was done alone. Every step of this journey was a collective effort. It was the countries, their leaders, and their communities who placed their trust in us. It was the global health community which recognized the importance of investing in this region for global health security as a whole. Above all, it was our team. A diverse group of hard-working, dedicated professionals from across the region, diverse in their skills and backgrounds, but united in their values, their commitment, and their passion for this mission. The EMPHNET 15-year report is more than a document. It's a record of proven practical initiatives, a guide for what works in our region's most complex contexts, and a foundation for the work ahead. 15 years of public health in context. The stories, the numbers, the lessons.